Injuries in sports and fitness commonly affect the musculoskeletal structures. We have the ligaments, tendons, muscles, and bones have inherent strength to help withstand strong forces, but their density varies to their collagen and elastin fiber contents. It also depends to the tissues when it comes to the ability to withstand sudden acute forces because it softens the impact on the structure. Acute injuries. So in sports and fitness injuries, it can be classified as to whether it is acute and chronic or overuse. So acute injuries have signs of swelling or pain that manifest immediately after the force application. On the other hand, the signs and symptoms of chronic or overuse injuries occur after the long period of injuries. So for example, if you're joining the competition like in sports, madagma dayon ka or ma-sprain or matagil po imong tiil. So that time muswell ang imuhang tiil. So mao na siya ang one example sa acute injuries. On the other hand, sa chronic or overuse injuries like kanang sa basketball na sige man nagdagan no, so dugay kaayo, balik-balik lang. So after a long period of time, some of the players kay mo ask sila og time out, it's because masakit na ang ilahang tiil. So mao na siya ang one example sa chronic or overuse injuries. Okay. Functions of various musculoskeletal structures. So sa structure, we have ligaments, function stabilize joints, and then acute injury is sprain. For tendons, it attaches the muscles to the bone, and acute injury, we call it strain. For the muscles, it creates movements, and the injury is strain. Bones anchors for muscles. The injury is fracture. Joints, fulcrum for movement, and acute injury is dislocation. How do overuse injuries occur and how are they classified? So overuse injuries are common among individuals who have been training for a long period of time with minimal rest and recovery between sessions. During training, the musculoskeletal structures receive higher loads than what it used to. So we have three categories for that. First, we call it, for the first degree, it's mild, and then fibers damage is minimal tear, and loss of function pain when move. So if imuha siyang i-move, maura siya musakit. And for the second one, we call it moderate, then second degree, partial tear, pain at wrist and when move. So if mag-urong lang and then i-move, musakit gihapon siya. For the third one, we have severe degree and then complete tear, complete loss of function. So wala na jud kay dili na jud nimo malihok ang imuhang kanang tiil or unsa nga part ang na injured. Okay, next. So there are three types of overuse injuries according to severity. We call it stage 1, stage 2, and stage 3.